Today we're talking about C. Diff. So everybody listen up. Did everybody sign in? No. When the sign-in board gets done over there, bring it over this way. And there's a couple of pieces of paper you need to pick up when you sign in. Recently we've had several cases of C. diff in the house. So we have updated our infection control policy. And we're going to talk about C. diff. Make sure you sign in and make sure that your sign-in is legible, and I will go in and give you credit for this class on your Healthcare Academy. So you won't have to go in and do it. Okay? There's two of them in there. One's on hand hygiene and one is on C. diff. So by attending today, you get two for the price of one. Oh. Okay, did everybody see Debbie and get your bonus check? If you didn't, you need to go see her. Okay? One of the things that we're going to be doing this year is every month we will be having a different system that we're going to be talking about. This month we're talking about GI. So next week, Fred will be giving, Michael will be giving an in-service on different types of diets and things like that. On the 18th, Dr. Chima will be here and he'll be talking about ileuses. Okay, and then I'm not sure what the last one is.
Bowel health. And then the last week of the month, each department does a department-specific in-service. So you're going to do skills for nurses and CNAs for
right.
ostomy care.
There will also be skills for CNAs and nurses. Okay, so throughout the month there'll be different things going on to kind of keep your skills up to date and keep you up to date on what's happening in different systems. February, of course, is Valentine's, right? So it's going to be Heart Month. Okay? Any questions or concerns or anything about that? Okay. Some of the things that we had a problem with is nobody knows, or who knows, when a person has C. diff when they come off of precautions. Does anybody know? Okay. C. diff, they have the liquid stools and they have a lot of them. Okay. Usually they can have up to 10 to 15 loose bowel movements a day in 24 hours. Okay. When they get to the point where they're having less than 3 in 24 hours, they can come off precautions. Now, what does that mean for you therapists? That means as long as they're having the super liquid stools and they're having a lot of them, they have to be in the room. Okay? When it starts slowing down, then when you get ready to take them to therapy, they have to wash their hands with soap and water, and so do you, and they have to have a gown on over their clothes. Okay? They can go to therapy, but they have to have a gown on.
Can you specify not an isolation gown?
Yeah, it doesn't have to be an isolation gown.
It should not be an isolation gown.
Really and
It
truly,
should be
yeah.
a regular patient gown.
The isolation gowns, there'll be the isolation kit on the door for those particular patients, and that's when you're doing hands-on care and you're likely to be splashed. Okay? So CNAs, when you're in there and you're cleaning them up and everything like that, that's when you need to be wearing those isolation gowns. Okay? Any questions about that? Yes, ma'am.
When they're in the having the really useful procedure, we're not taking therapy.
No. Okay, because if they can't control it, they don't need to be out in the general population. Okay? When it slows down and they're having maybe 2 or 3 episodes a day, then yes, they can. Okay? Just make sure that they wash their hands with soap and water and you put a hospital gown on them. Preferably so it's open in the front. Okay? That way it contains any kind of spores or anything that might be accidentally coming off of it. Because the spores are what is the hardest to kill. Okay? And in the video that you're going to see, it will explain a lot of that too. Yes, sir?
Just to clarify, because I thought we cannot bring the patient out with that gown on.
For that you can.
Okay.
But not with only a gown on.
They have to have their street clothes on.
It's a clothes and then on top is the gown.
Right.
That a gown.
Okay.
Yes.
Yeah, don't bring them out with just their gown on. It's enough of a light show, you know? All right, we're going to go ahead and start this. We will be asking questions as we go. If you have a question, let me know. We'll stop the video and go through them. There's more down here on this table, down by the cookies and all the goodies. Okay, one thing I want to explain to you, when you go into Healthcare Academy, this top one is always the course, okay? If you don't do the bottom one, you will not get any CEU credit for it. All you have to do is click on it. It's an acknowledgement that you did the course, okay? So make sure that you do both of them.
Welcome to Clostridium difficile, information for nursing assistants, a course offered by Healthcare Academy.
And it says nursing assistants on it, but it's good for all staff.
During this lesson, we'll discuss the topics listed at the left. Each topic has a related objective. At the end of this lesson, you will be able to define Clostridium difficile, identify the symptoms of Clostridium difficile illness, identify the causes of Clostridium difficile infection, identify the risk factors for Clostridium difficile, describe the role of the nursing assistant relative to stool sampling and documentation, identify what precautions should be taken to prevent the spread of Clostridium difficile, and identify how to clean the environment in order to prevent the spread of Clostridium difficile. At the end of... Let's take a moment to get acquainted. The average human digestive tract contains as many as 1,000 species of microorganisms. Most of them are harmless, often helpful under normal circumstances. But when something upsets the balance of these organisms in the digestive tract, otherwise harmless bacteria can grow out of control and make a person sick. One of the worst offenders is a bacterium called Clostridium difficile. Clostridium difficile, referred to as C. difficile, C. diff, or CDI, is an organism bacterium that attaches to the inside of the person's intestines and causes an infection. The organism produces two toxins that can cause a variety of problems ranging from mild to moderate diarrhea to life-threatening infection. C. difficile can form spores, allowing it to survive in the environment. Example, in soil and on dry surfaces for extended periods of time.
On dry surfaces, the spores can live up to 5 months. That's why
Older adults in the hospital or long-term care settings are most often affected. The infection commonly occurs after people have been taking antibiotics. However, C. difficile has also been identified in younger people. Over 500,000 people get sick each year because of C. difficile. C. difficile is becoming more frequent, more severe, and more difficult to treat. Let's review what you've learned so far. Clostridium difficile is a virus, bacteria, mold, or fungus.
the bacteria, right?
Correct. Which population is most often affected? Infants, children, younger people in hospitals, or older adults in healthcare settings? Correct. Some people have C. difficile in their intestines but never become sick. However, they can still spread the infection. The illness usually develops during or within a few months after a course of antibiotics. The symptoms range from mild to moderate infection to a severe life-threatening infection. If you are taking care of someone who has diarrhea or any of the other symptoms, you should alert the nurse. Click on the links to learn more.
Okay, mild to moderate infection. The most common symptoms of mild to moderate C. diff infections are watery diarrhea 3 or more times a day for 2 or more days, mild abdominal cramping and tenderness.
You just step away from
Okay. A severe infection, the symptoms are watery diarrhea 10 to 15 times a day, abdominal cramping and pain, which can be severe, fever, blood or pus in the stool, nausea, dehydration, loss of appetite, weight loss, a swollen abdomen, kidney failure, and increased white blood cell counts.
Any questions about any of that? We've all seen it.
Let's review what you've learned so far. Which of the following symptoms is common with mild to moderate C. difficile infection? Watery diarrhea 3 or more times per day, weight loss, watery diarrhea 10 to 15 times per day, or kidney failure? Correct. Which symptoms should be reported to your nurse? Fever, diarrhea, severe abdominal pain, or all of the above? All of the above. Correct.
Okay,
Before we move on, I heard rumors out in the hallway today that housekeeping didn't need to attend this in-service. Why do you guys need to attend this in-service? If you're in a room and you're cleaning up diarrhea 40 times out of a day, you should be talking to the nurse. It doesn't make any difference whether you're a CNA, a therapist, or whatever, housekeeper, maintenance. If you see a patient that's having that much diarrhea, you need to talk to the nurse. She may already know, but it doesn't help to put your input in there, okay?
C. difficile bacteria are found in all areas of the environment, including soil, air, water, human and animal feces, and food products, such as processed meats. A small number of healthy people naturally carry the bacteria in their large intestine and are not ill from it. C. difficile infection is most often found in healthcare settings because there are a lot more people who carry this bacteria. However, we are beginning to see more people in the community with the illness as well. The C. difficile bacterium is passed in feces and spread to food, surfaces, and objects when people who are infected don't wash their hands completely. The bacteria produce spores that can persist in a room for weeks and months. If you touch a surface contaminated with C. difficile, you may then unknowingly swallow the bacteria. This is one reason that thorough hand hygiene is essential in preventing the spread of the infection.
How long do you wash your hands? At least 20 seconds. With C. diff, you wash your hands with soap and water only. The hand-based alcohol, whatever white stuff, will not kill this bug. It won't kill the spores.
A person's intestines contain millions of bacteria, many of which help protect them from infection. But when a person takes an antibiotic to treat an infection, the drug can destroy some of those good bacteria as well. When the good intestinal bacteria are killed, C. difficile can rapidly get out of control. When it takes over, C. difficile can produce toxins that attack the lining of the intestine. The toxins destroy cells and produce spots of inflammatory cells and decaying cellular debris inside the colon, which causes the watery diarrhea commonly seen. A newer, more dangerous strain of C. difficile has recently been identified that produces more toxins than the older strains do. This new strain may be more resistant to certain medications and has been identified in people who have not been in the hospital or taken antibiotics. This strain of C. difficile has caused several outbreaks of illness since 2000. Let's review what you've learned so far. How is Clostridium difficile passed? From contaminated urine, in the sputum, in the stool, or in the blood? Correct. Anyone can get sick from C. difficile, however, some people have risk factors that put them at higher risk for contracting the illness. Click on the links at the right to learn more.
Okay, taking antibiotics or other medications. Medications that put a person at higher risk for getting C. diff include antibiotics and medications that reduce stomach acid, like proton pump inhibitors and the things we give patients that have GERDs.
Mary Alice, you should probably mention there should be a stop date on those medications.
Okay. If we have a patient that is on these proton pump inhibitors, if they have a diagnosis of GERDs, they'll be on that medication longer. However, if they don't, we need a stop date. It should be anywhere from 14 to 30 days. The most common places that C. diff infection occur are in healthcare settings like hospitals, nursing homes, long-term care facilities, where germs can be spread easily and the person's immune system is already compromised. C. diff is spread mainly by the hands from one person to another, but it can also be spread with contact with cart handles, bed rails, bedside tables, toilets, sinks, stethoscopes, thermometers, telephones, and remote controls.
So we're going to, those with C. diff, we have disposable blood pressure cuffs and stethoscopes. You're to use them for those patients only. They do not come out of the room. We also have the disposable strips for to detect temperatures. For pulse ox, we will need to clean those with your bleach wipes. They'll need to sit for 10 minutes in the bleach wipe. So you need to be sure that we do that. We don't have disposable pulse ox.
Unfortunately, I'm not sure they make them.
No, they don't.
Okay, another risk factor is residents who have a severe illness such as an inflammatory bowel disease or colorectal cancer, or they have just a weakened immune system. They are way more susceptible to C. diff. Another risk factor is the elderly. Those who are over the age of 65 are 10 times higher in risk for contracting C. diff than a younger person would be. And if they've had a previous C. diff infection, their chances of getting it again are about 20% higher.
Let's review what you've learned so far. Where do most C. difficile infections occur? Acute care hospitals, home settings, long-term care facilities. Click on all that apply.
How about acute care and long-term?
Correct.
No, you don't, most likely don't get it at home.
C. difficile can be found on which of the following? Healthcare workers' hands, bed rails, toilets, or remote controls. Click on all that apply. Correct. If a patient is suspected of having C. difficile infection, you may need to record their bowel movements. This includes recording the number of episodes, consistency, and any other items outside the resident's normal bowel movements, such as foul odor. Some facilities have tools or scales in place to assist you with identifying the consistency, such as the Bristol stool form scale. The consistency
Yes,
is an important indicator of the disease.
I'm sure they got it on Facebook too.
Toxins produced by C. difficile bacteria can usually be detected in a stool sample. You may be asked to collect a sample of that stool. Referring to the Bristol stool form scale, types 5 through 7 are what is often collected and sent for testing. Formed or hard stools should not be sent for testing because the testing would not be accurate and could lead to unnecessary treatment of the patient.
Okay, just so you know, if we're collecting a stool for C. diff, it has to be liquid. The lab will not test it any other way, and they will not do secondary testing. So if you mess it up the first time, you can't send it again, okay?
let's review what you've learned so far. Which type of stools will be collected and sent for testing? Formed, solid, or watery or hard? Correct. When a resident has C. difficile, it is important to count the number of stools. Yes or no? Correct.
Why do you count them?
What's one of the reasons why you would count how many stools they have? You can tell if they're getting better because the number of stools are going to decrease as they're getting better.
To help prevent the spread of C. difficile, you should follow strict infection control guidelines. Preventive measures include hand hygiene, contact precautions, equipment, thorough cleaning, visitors, and interaction with others. Click on the links at the right to learn more.
Okay, you have to practice good hand hygiene before and after coming in contact with each resident. In the event of a C. diff outbreak, you're going to use soap and water is a better choice for hand hygiene because alcohol-based hand sanitizers do not effectively destroy the C. diff. Good hand hygiene is the most important factor in reducing and preventing the spread of C. diff. Do I have to do hand hygiene demonstration for you guys? I shouldn't have to. Okay, this is probably the biggest question I hear, is what kind of precautions do we do? We do contact precautions. The resident should have a private room with a private bathroom. If a private room is not available, the resident can share a room with someone who has the same illness. But they should never be placed with someone who has an infection, a pressure ulcer, an indwelling device such as a Foley catheter. Okay, if the resident has to share a room, he or she should have his or her own commode. Okay? You should wear disposable gloves and gowns while in the room. Normally, the resident can be taken off of isolation after their symptoms have resolved or they have less than 3 unformed stools in 24 hours.
So does that mean they get the bedside commode?
No, it does not. That means, so let's think about this. The roommate gets the bedside commode. Why does the roommate get the bedside commode? Huh? So if the infected person goes in the bedside commode and dumps it in the toilet, then it's already infected. So the roommate has to have the bedside commode, or if the patient is incontinent, if it's contained to a brief, a disposable brief, then the roommate can use the commode.
Okay. All surfaces should be thoroughly disinfected with a product that contains bleach. Okay? C. difficile can survive routine cleaning products that don't contain bleach. The best type of solution to use is a sporicidal, which kills spores, okay? That has been approved by the EPA. And it's usually a 1 to 10 concentration. Okay, also, when possible, we need to use disposable equipment, such as blood pressure cuffs, stethoscopes, and thermometers. Okay, visitors should be instructed to wash their hands with soap and water before and after leaving the room or using the bathroom, okay? They should also wear a gown and gloves when they go in the room. Okay, in a nursing home setting or our setting, it's essential that all residents have interaction with other people, okay? However, if the resident is unable to contain the body fluids, they should not leave their room while they're sick. If the resident can contain their body fluids and perform hand hygiene appropriately, that means they need to be able to wash their hands the same way you guys do for 20 seconds, soap and water, okay? They should be allowed to participate in activities outside the room. They should be given specific instructions for the hand hygiene and monitored to make sure they can perform it correctly. That means you guys need to watch them do it, okay? Before they're leaving their room, they need to do the hand hygiene and use a gown over their clothing, okay? All equipment should be disinfected before the patient leaves their room. So that means that their wheelchair needs to be wiped down, all of that good stuff, okay? And we'll probably do a dedicated gait belt to that patient.
Question Leo?
Yes.
Every time the patient is
Let's
out,
review what you've learned so far. During an outbreak of C. difficile, healthcare workers should wash their hands with soap and water or alcohol-based hand sanitizer. Correct.
Okay, go ahead.
Okay, now,
My question is that if those equipments at the back of the therapy, those equipment that's been out in the room, are they already been sanitized or we have to sanitize it?
Say
I
that
remember
again.
when the patient's out going to the hospital, discharged home, some of the equipments like the hormones are stuck on the back. Are they already sanitized before they get out or we have to sanitize it?
David's housekeeping crew sanitizes it when it leaves the room.
All right.
Okay? But now, if you guys put something back there, and you need to give it to housekeeping first, before we put it back in that area. Yes, ma'am?
So if we have a patient that have a C. diff, not all the staff know that that patient have the C. diff, right?
You will know.
Right.
Now you will.
Now we will. But I know that we have one that we probably, not everybody knows about it. Do we put gloves and gowns outside their room or visible to everybody, for the staff and for the visitors, so they'll be like, oops, what's going on? There's a gown.
We started doing that today, so we just changed the policy today. So now we do have 2 rooms with active C. diff.
you'll see a container hanging on the door, and it will have everything in it.
That's the reason why I'm asking that question, because I haven't been able to observe that we are doing that. So we are just now doing that.
Doing that today. So if you walk on 100 or 200, you should see the 2 rooms over there.
Okay, thank you.
Which types of precautions should a resident with C. difficile be placed on? Standard precautions, contact precautions, droplet precautions, or airborne precautions? Correct. When possible, you should use disposable blood pressure cuffs, stethoscopes, and thermometers. True or false? Correct. Isolation precautions can be discontinued when the resident's treatment is completed. The resident feels better, the resident has less than 3 unformed stools in 24 hours, or the resident should not be taken off of isolation precautions. Correct. Because C. difficile spores can reside on any surface, the environment is significant in the spread of the illness. C. difficile can last up to 5 or 6 months on hard surfaces. The heaviest contamination has been found on the floors and around the bathrooms of residents with C. difficile. However, it is important to clean all equipment and surfaces. The spores are more difficult to kill than the C. difficile bacteria. The following guidelines should be followed when cleaning the environment. Clean the room and hard surfaces and/or equipment in the room with a 1 to 10 dilution of bleach daily and upon discharge. The housekeeping staff will usually do this, but it's important that nursing assistants understand what cleaning solution to use for this illness. After cleaning a piece of equipment, the surface should stay in contact with that cleaning solution. Stay wet after cleaning for a certain amount of time. In most cases, the specified time is 10 minutes. However, the contact time may vary, so you should become familiar with the particular agent you use to clean surfaces.
Okay, so we use our wipes, our bleach wipes comply with that, and our bleach wipes is 3 minutes. So it needs to stay wet for 3 minutes. So, you know, most of the time that's not a problem in Florida because we have such high humidity. But if you do have a day where it's cold, you might have to wipe it twice so that you keep the 3 minute, it wet for 3 minutes.
Let's review what you've learned so far. Resident rooms and surfaces should be cleaned how often? Monthly, daily, weekly, or as needed? Correct. When cleaning surfaces, it's not important how long the solution stays in contact with the surface before you wipe it dry. True or false? Correct. You have successfully completed this lesson, and it's time to take the quiz. Upon successful completion, you'll be given an opportunity to print a certificate.
So everybody can hear me. Let's go over. So, let's say you have a patient, let's see if this answers it. You have a patient who's having diarrhea for multiple times, okay, in a day, and it's watery and it smells like it's C. diff. What do you do? Tell the nurse. What's the second thing you're going to do? Get a sample. Isolate. We're gonna get the sign. The signs are going to be in your central supply room, and you're going to get out the gloves, the gowns, and the bleach wipes, right? And put the disposable items in the rooms. Thank you very much. Absolutely. Those are all going to be in your supply room. So those will be dedicated for them. If we even suspect that they have C. diff, we'll do the test. Test comes back negative. We take it all away. No harm, no foul. We're going to have an information sheet that we give to the patient, and the patient can also give to their family, letting them know what they're supposed to do. The proper hand washing, try to stay in the room while they're not feeling good. As soon as they have less than 3 loose stools in 24 hours, they need to tell us. And we need to check on them. We need to make sure. They're going to do as much therapy as possible in the room, but if that's not possible, then we have them wash their hands, put a gown on, then come out of the room. We understand sometimes it's prolonged. They're going to be, they're not going to want to stay isolated for too long. So sometimes you're going to want to get out of that room, so then you can allow them to do that. Any questions? Yes, ma'am.
Yes. So if they're going to get out of the room, I just want to make sure that everybody understands, we need to make sure that their shoes, if they are wearing shoes, should be white. Their wheelchair wheels should be white. I know it has been discussed, but honest to goodness, I know we don't do that.
Absolutely.
We don't wipe the wheels of the wheelchair. We need to wipe the wheels of the wheelchair before they step out of their rooms. Their shoes, the bottom of their shoes needs to be wiped, or change their socks before they step out of their room, before they go to therapy. And make sure they wash their hands before they go to therapy.
She has a very good point there. Ivy says to pay attention if they're coming out of the room for therapy and they have active diarrhea. Now, I doubt they're going to feel like coming out of the room to go to therapy when they have this much active diarrhea. But if that is the case, and they're insisting they got to get out of that room, then let's wipe down the bottoms of their shoes, the wheels on the wheelchair, the footrest, the foot pedals on that wheelchair, anything that everything, the handles on the wheelchair, the armrest, everything really. Yeah, we want to be squeaky clean. Yes, Miss Twyla.
For the linen, the mess up the linen on the what kind of diaper they put the linen?
It'll go into regular linen. Your regular wash cycle will kill the C. diff. Just when you're in the linen, with any linen, you don't
You hold it away.
you don't spread spores around. You put it directly from one to the other and try and minimize the aerosolization of the spores.
If they have a bowel movement, shouldn't it go in a vinegar bag?
It won't hurt it to go in a vinegar bag. It will cut the smell.
It will cut the smell. It'll be helpful.
It kills the germ.
Okay. Do we have them on? Okay, that's fine.
So put them in the vinegar bag and then put it in a regular bag. So
Okay. Questions? Everybody, did you sign? Sign-in sheet? I have it here. If you have it, you will get credit for this. 2 CEUs. Yay, absolutely. And you don't have to do it online. Mary Alice is going to put it in your electronic medical education chart, and it'll go to CE Broker. All right, thank you guys.